Hello, my name is Beth Hawkins Bradley. We're going to discuss basic wound dressings in this program. We want to help you understand the foundational dressings that you're going to use with most of your wounds, especially as you begin treatment. Our payors require that before we use advanced technologies, that often we use basic dressings for a period of time before we can access the more expensive technologies. But frankly, if you treat your wounds well, you can heal many of your wounds using the dressings that we're going to discuss today. What I want to do too is enable you to evaluate products so that if someone comes to you, you are going to be able to look at a dressing, know how to use it, and know whether you want to integrate it into your formulary. So that's where we're going to go today. As wound care clinicians, a lot of times we just want to rush to the dressing selection part. But I want to remind you that there are important things that you need to consider before you just go to your formulary, that wonderful place, and choose the dressings that you want to use on the patient's wound. To begin with, you always want to identify factors that have caused the wound, factors that are delaying wound progress. If you don't deal with those two questions or those two issues, you're not going to be effective no matter what dressing you use on that wound. You want to consider the patient when you're choosing the dressing. Is this a dressing change that he can do at home or that a home care nurse can do? You want to consider the cost of the dressing. Is it reimbursed? Is the copay something that he can deal with? So the factors on this slide are really important for you to consider before you ever send a patient home with a dressing. You know, frankly, I have not considered patients put the patient on a wound care regimen that I thought was the best thing ever. They go home, they're not going to do it. They don't know how to do it or they don't want to do it. So you really want to make sure that the patient is going to buy into your treatment regimen if it is an outpatient or home patient.